Hello, my name is Bob Cobley, and I'm the owner of Spectrum Lasers. I want to thank you for purchasing a new Spectralase S-3 diode laser. We think this laser is really special, and I'm recording this training. So let's get started. Now, I'm going to cover a lot of things. It's going to be a lot of information, and some of it is pretty obvious, but I'm going to go over it anyway. So what I'm going to do now is screen share, and we're going to go to this keynote presentation. Hopefully you can see this. Of course, this is our laser, and as you know, I mean, this laser, we've been in business since 1998, and there's many years of research that's gone into this. This is not just thrown together. Of course, here's the back of our laser. Um, now, I sent you these links, and they're also on my website. It's very important that you watch these. Of course, the laser setup. It shows how to use the 450 for bulk tissue reduction, pain management, the handpiece, and then of course the 980 cutting demo. So I'm not going to cover that now because that's on those videos. So safety wise, there are no contraindications. Pregnancy, pacemakers, nothing harmful at all, except for this wavelength is attracted to pigment, which is your iris and your pupil. That's why you wear the glasses. FDA says everyone within 3 feet needs to wear the glasses. Now, the laser energy comes out in a cone shape like this. It does not shoot across the room. That's why it's totally safe in an open bay. Now, you would basically have to point this right in somebody's eyeball an inch or two away to cause any damage. Now, lasers have been in dentistry since 1991 and zero recorded accidents, zero. Nothing harmful, pregnancy, pacemakers, anything like that. So let's say mom wants to watch the procedure. Just have her stand more than 3 feet away. These glasses are expensive. They're $199 a piece. And you need to clean them with just soap and water, not operatory cleaner, because it will eat the finish off. You've got 2 pair of the safety glasses, 1 pair of goggles for the patient. Now, if possible, we recommend putting the laser on a cart. But if not, you're going to want to, after you use it, have your team members clean the laser, cleave the fiber, get it ready for the next patient, even if you're going to put it away in a cabinet. So it's ready to go. Let's say you're seeing little Jimmy on a Tuesday morning. You don't have a laser scheduled, but if you know that a little cuspid exposure is going to, doctor time is 25 seconds. If it fits in your day, you could say, just bring it over. I'll do it right now instead of a whole new appointment. Yeah, I work with Dr. Pitts, and they're constantly talking about saving appointments. So you can do that. And some of this is in the videos, but with the laser handpiece, you can clean it in a sterilizer or wipe it down, but never take the nut off the end of that handpiece because there's a little pressure fitting inside that keeps the fiber from slipping. If you take the nut off, you're going to lose that fiber. Now, our older lasers had little plastic tips that that bent. I don't know if you can see this here. Yeah, we now have metal tips. Now you can bend those tips more if you like. It comes with, I think, 3, and they're autoclavable, or you can wipe them down. Now they can get a little bit hot because some of the energy can escape out the sides of that fiber. So you might want to occasionally spray it with a little bit of water, maybe a little damp gauze, so that you don't, in case you accidentally touch a patient's lip, it's going to burn them. So in the video, you'll see how to cleave and use the micro stripper and that kind of thing. So let's see here. All right, any kind of parts or assistance or anything like that, you contact me. This is the formula for the strong topical. This is on my website, and it's on that laser procedure guide that I sent you. I recommend that you have it made locally. Now, there is a place in California you can get it, but locally it's going to be less money for you, and it's just easier. So you just give them the formula, they'll make it. So fibers, any parts, any issues, anything, contact me. You have to carbonize the end of the tip for the 980 use only. Now in the video, it shows you how to carbonize the tip. We take the tip, we set your laser at 1.0. We either sort of move it on articulating paper and burn some ink on the end of that fiber tip with the foot pedal down, or use a Sharpie and coat the end of that tip. Now, this wavelength is attracted to pigment. So we're going to burn some pigment on the fiber tip and it becomes a hot tip. It'll cut. Now, you can't overdo this. It's probably the most common mistake is that it's not really thoroughly carbonized, so it won't cut very well. Now, the 450, which we'll get to, you do not carbonize that because that's out of contact. You're cutting out of contact. With a 980, you're touching the tissue. 450, you're not. So on this procedure guide, there's just two pieces of paper, and it's kind of lists everything you need to know. Your settings on a 980, 1.0 to 1.2 is for normal soft tissue. 1.4 to 2.0 for fibrous tissue. Just increase it. Now, what we want to do is avoid producing black char. Char is a result of too much energy. Now, the char does not hurt the patient, but the laser energy has trouble penetrating through the char. So you'd have to stop and clean off the char. Now, there are some cases where you're going to produce char. You just have to. So have the assistant in there with a micro brush and some water and just kind of constantly cleaning it. Now, when we go down here to the 450, the 450 is 2.5 to 4.0. You're just going to have to figure out what your patients can tolerate. Now, according to our testing, which is Dr. Frost, he'll use somewhere in that range. He likes 2.5. If the tissue is, no, this is with topical only. If the tissue is really thick and fibrous, you might have to increase it. If you don't give injections, the lowest energy setting that you can get by with, the better. Now, and then the pain management, which is on the video, but you'll use a 0.60, and there's a timer, and you'll set it for 20 seconds. Press the timer to start. It'll shut off the laser in 20 seconds. 20 seconds per quadrant. Now, you can do it for longer if you'd like. Now, and I mentioned in the other video, there's a little gray area here if the assistants can do it or not. I have some doctors, the assistants do it. They figure, well, a curing light, they use a curing light. We use this light, we call it light therapy. You'll have to figure out what you want to do on that. All right, this kind of procedure here, typical cuspid exposure. They're going to apply the topical, like a liberal amount, kind of like you would etch. You'll time it for 4 minutes. It doesn't have to be exact. And then you're going to wipe it off or suction it off. We're not going to rinse it off. Rinse it off is going to go down and numb out their throat. It's not going to hurt them. It's going to scare them. So, and then after you wipe it off, most doctors wait another 5 minutes. Let the patient sit for 5 minutes. So basically, when your assistant starts applying topical, they'll be ready for you in 10 minutes, but they'll be numb for at least 15 minutes. So you don't have to rush right over. So when we're ready to do our procedure, we want our target, every time it's with a 980. I'm talking about 980 for this. Well, for all of our procedures, we want our target tissue to be wet, but not flooded. But with the 980, and be some videos, we're going to hold our fiber tip pretty close to perpendicular, touching in contact. We're going to hold it in one place until we feel it penetrate. And for this setting here would be probably 1.2. And we're going to slowly make an incision around the perimeter of our opening until we're down to the tooth. We can feel the tooth. Remember, we can touch tooth, we can touch bone, we can touch metal, and we're down to the tooth. Now we're going to grab this flap of tissue with maybe little cotton pliers or forceps or something, take the fiber and go underneath this flap and undermine it and just lift that flap off. Then we're going to, with a cotton pellet and some water, just clean up our margins, dry it, and bond. When you get the hang of this, this is going to take you 20 seconds maybe, and dry it and bond. Another one like so. Dominic Bacchus, you do these all the time. They're so simple. This tooth is right under the surface. You want a little more room here too. This whole thing is, 30 seconds maybe. Now, let's just imagine this is 3 millimeters thick. Now, if it's 3 millimeters or so thick, I would go to the 450 because it'll cut faster. And we're going to make an incision around our perimeter. And we're going to make an incision until we get down to the tooth. With a 980, this is probably a couple of minutes. With a 450, probably 30 seconds, maybe 45. We'll get down to the tooth and just lift it off. Now, I was with Dr. Pitts with the residents at UNLV, not this case, but just like it. We opened it up and it was not tooth structure, it was bone. So Tom said, take a handpiece and just shave the bone off. Take a hand instrument and scrape the bone off, or just leave it, it'll break through. But we do not cut bone with these lasers. Other lasers, but not this. Now here's a little video. He's going to do 2 cuspid exposures. He's moving the fiber tip a little faster than what I would like. The slower you move it, the faster it'll cut. When you move it faster, you need to increase your power a little bit. Maybe, for this case here, maybe 1.6.
I don't like to expose the whole test bit. I like to just probably do the lower third so that I can get a bracket on it. A little bit more on this side. And that'll give me sufficient room now to put a bracket on it too. So we'll do the left side. Real simple, fast procedure. Saves a lot of treatment time for the patient and for myself.
So maybe you notice they did spray a little bit of water. You're going to do this kind of thing, little access gingivectomy. We do not have to worry about biological width on this. If we violate biological width, it's just going to grow back. Now, for recontouring, we do, and we'll get to that. Here's one here, Dr. Sarver. He just wants access. Now, I don't think that's very thick, but kind of the 450 is for thicker fibrous tissue, but you could use it on any tissue. But even with the diode here, this is, gee, I don't know, 20 seconds to expose this. And he's not worried about this. He's not concerned about this margin being beautiful. We're going to do that later. He's just getting access. Now, here's an example of they're going to start where they want to finish. And look at all the carbon on this tip. See that? That's a lot of carbonization. So he's going to hold it one place. He's going to feel it penetrate. And he's moving really slowly. He's going to excise this whole piece, opposed to starting at the margin and working up. And obviously, this is, prior to placing the brackets, just getting access. Just slow and steady. Suction right there close to collect any plume or odor. And then we just excise that piece. You're done. Okay, now here's an example of slow and steady, holding the fiber chip pretty close to perpendicular.
If I ever feel myself facing a little bit, I just stop and do something else. Yeah.
Now, after you've done several of these little exposures and things, and you get comfortable with laser tissue interaction, then we're going to graduate to what Dr. Pitts calls the wow factor, which is this. In the Pitts Masters, we talk about this. The braces come off. We've got this. We don't want that. We want this. So you need to let the patient know that we're not finished yet. Now, I don't know how. I've been thinking about this. Maybe you want to let the patient know ahead of this appointment that we're not going to be finished, because maybe they're thinking the braces come off, we're completely done, I'm going to be beautiful. But you're not until you do the recontouring. So ideally, if you could do this gingival recontouring at the same appointment, then you're finished. One retainer, you're done. I know it's a long appointment, but the sooner you can do it, the better, because the less time the patient's going to be walking around with not a very good result with your name on it. So also, I recommend in a new patient exam, the type where they might be going to 2 or 3 different offices to figure out who's going to do their treatment, you show them this case or copy and paste something from mine. Oh, and you also show this to your patient that you're going to do the treatment on, and tell them that we're going to use a special laser and a little numbing jelly, and we're going to shape your gum tissue and make it look just like this. So, but on that new patient exam, you want to let that prospect know that we do that here in our office. We're not going to refer you to a periodontist for $4,000 or $5,000. We do it right here. So if that patient goes down the street to another doctor, if that doctor doesn't use a laser or doesn't tell the patient that they do it, the patient doesn't know. I mean, here's a case. Here's an interview I did with a mom.
And my son just had a laser contouring by Dr. Frost, and it was just amazing. I cannot believe it. I am stunned at how much better his smile is. When he got his braces off, it was a little bit of a letdown because I couldn't believe how small his teeth were, and I am just amazed at how his smile looks today. It's a different smile completely.
Well, she had no idea that this is even possible. So you've got to tell them you can do it. So in that new patient exams, it's the time to do it. So, and then, you see these all the time. We can just clean that up. And Dr. Pitts says, the patient, they don't know what they want, so you just show them what we can have. And this is Tom's master's orthoevolve.com. So how do you do gingival recontouring? Well, when I lecture, I tell them you have to go buy one of my lasers. And then I recommend you go to our training page and you read this article by David Sarver. He talks about height to width ratio of the teeth. So you have that vision of what you want it to look like when you're finished. We're going to measure in the sulcus, and we want to leave 1 millimeter of pocket when we're finished. If we do that, we're not violating biological width, and it will stay exactly where you trim it. It's not going to grow back, rebound, recession, anything. It's going to stay exactly where you trim it. So in a case like this, we've already probed and we know how high we want to go. Now, with our 450, the first thing we want to do is thin down these papillas. So the 450 is for the bulk, the 980 is for the precision. So we're going to press the button to 450, non-carbonized tip, out of contact, and we're just going to cross hatch. We're not going to really do the margins. We're just going to go along and just smooth these off. And it won't take very long at all. This whole thing here, I don't know, really, a few minutes. And then we're going to press the button for 980, carbonize the tip, and then we're going to do the margins. And the margins here, we're going to start at this central, and I have some videos. We're going to shape this central how we like it. Sarver says the zenith, the highest point should be about 1 millimeter distal on all the teeth. So we're going to get the central how we like it. Then we're going to do the other central so it's mirrored. So, and then we're going to go and do the canines the same height. And then the lateral is a little shorter. Then we're going to go all the way down the corridor. Every case I'm going to show you, they go all the way down the corridor. We're widening everybody out. They're showing more teeth. So we need to take care of that tissue. Now, what we're going to do here is we're going to take, after we've lasered this, we need to clean it up. We used to have you take a cotton pellet and clean this up and take 15 minutes. Now we dip a toothbrush in hydrogen peroxide and just brush it up. Takes 5 seconds. It's probably not going to bleed at all, but maybe if it does a little bit, it's not a problem. So we're going to clean this up. And then we're going to take a vitamin E gel cap, ordinary from the drugstore, break it open, put the gel either on your finger or the Q-tip and just massage it in the tissue. It's good for healing, makes them look prettier when they go home. And now post-op, you're going to give the patient 3 or 4 vitamin E's and tell them once a day, just break open that gel, put on your finger, massage it in. It's good for healing. Tell them that you'll be completely healed within 7 days, but it's really about 3. So you want to give yourself that wiggle room. You'll find that, I mean, almost never will you have post-operative sensitivity. It just doesn't happen. And it doesn't happen during procedures either. Here's a case. See the tissue turned a little bit white from that hydrogen peroxide. But see, a really nice case. Huge improvement. Post-op instructions I just talked about. Here is smoothing off a papilla.
Okay, so the thing you're left with this, yeah, that's not gonna heal very nice, right? You have to come in and thin this patella out of it, okay? Does that make sense? Sounds like nice edge. Yep. Take it down for a year and
Now that's for the 980. And as you know, this is a brand new laser that's 450. I'd probably take the 450 and just smooth off any papillas. Like that's kind of big over here. It's just faster, more efficient. Now here's another one where he's talking about black triangles here. Suctions in there close.
I'm very careful not to go into the patella. I'm not taking where the height or the length of the patella. Stop before doing that. Otherwise you go through and respond. Also kind of do back this just a little bit. Get the contours.
So for these recontouring cases, the assistant's going to be in there constantly cleaning with a micro brush. And what he said, we stop before we get to the top. We're not changing the length of that papilla. He's going to bevel some tissue. And he's going to talk about, he notches out this little thing, the suction is a little easier. The assistant can have a damp 2x2. If tissue globs up the end of your fiber tip, wipe it off on the gauze. You do not have to recarbonize every time you wipe it off, or just flick it into the suction. So here is this. He's going to bevel.
Notice on the suction tip, we put them on the carbide for made a little spot right in. Laser in the tissue that's on it. Now we're just a little bit thick right here, so I'm just gonna do a little bit of cross section. Thin this tissue out. Stop.
Now there's another technique too. You can take your fiber tip and you can carbonize it about 2 millimeters up the side of the tip. And then you can hold it horizontally to the tissue, to the margin, and just kind of ever so slightly bevel it. But if it has any thickness, then you have to use the tip like he just did. Here is, not sure.
So now I'm going to the other side. So now I'm going to turn this over here. Good. And I'm going to match the left line to the right line.
Now, the first recontouring case you do is going to take an hour. And then when you get the hang of it, it's going to be about 15 minutes. The more you do, the better you get. Here's also cleaning some papillas, smoothing them down. And he's going to bevel the tissue a little bit also. It's beveling right there. Now, here's some cases. I mean, I think this is a beautiful case. You know, orthodontically, it's probably perfect. I mean, if Sarver did it, but that's not a good smile. But now it is. I mean, just by doing that tissue. And, you know, I'll go through these pretty fast. Maybe you've seen some of these. Here's Dwight Fry in Chicago, from Chicago. Before he had a laser, he'd be done right now. Or he'd refer it. They probably wouldn't get done. And now with a laser, now it's really nice. Now notice he didn't completely smooth those papillas down, but they healed beautifully anyway. So this Dr. Bovenizer, before he had my laser, see that tissue is a little chewed up, a little bloody. That's from too much pressure with the fiber tip. That fiber is glass, so it becomes a scalpel. You press hard and you scrape on it, it'll make it bleed. So a little lighter contact, if the tissue is thin and soft and nice. If it's thick tissue, then you got to apply pressure. But it's still healed beautifully. Just no sense in making them bloody if we don't have to. This is a year later. It didn't move at all. He took this little girl from this to that. Really nice. And this kind of thing that you guys see all the time. Another one, Trevor Nichols, really good at it. Here's one that's mid-treatment. Now, here's a couple cases here. In this case here, I would use the 450. I would debulk it first, just debulk it, and then go back and do the margins for the 980, because you can get more precise with the 980. Same with this one. Although he did do this with a 980, of course, he did this before we had the 450. It just takes, you can do it with just a 980, but it takes longer. But I think this is a nice case. And here's a Vince Santucci in Wichita, Kansas. Look at this. That's a beautiful case. Now, I'll get into charging, but Vince told me that he charges $500. He figures it takes him 15, 20 minutes and he needs to charge. Now, I have no idea what his fees are or anything, but so he says 500 is doable because, you know, if it's 2,000 or 3,000, they're going to decline the treatment. I said, well, how many did you do last year? He said 150. Well, that's $75,000. And more importantly, it's 150 cases that are a whole lot better than if you didn't do it. But like, that's really, I think that's gorgeous. And this too, look at that. Now, see, this would be 450s, both of these. 450, and then go in and do the margins. This is a 980 because many of these cases were sent to me before we had a 450. I'd use a 450, thin this out quickly, then go back and get precise. But this is a resident. I mean, he doesn't have much experience at all, but this is a really nice case. Now you clean that up, hydrogen peroxide, put some vitamin E, it look pretty. Here's a case here, another 450. Just debulk that whole thing. Now he is going to do heart tissue recontouring also. So another 450 here. This is thick. I mean, you could do this with a 980 only. It just takes longer. Now, this is something here. I have a few doctors, very few, that will do the recontouring before the braces come off, a few weeks before. And then when the braces come off, there's a little touch up and you're done. The problem with that is it's harder to do with the brackets in the way. So, but you could, that's an option. Jorge Gutierrez in Mexico City. He works at the Pitts Masters, really good. He didn't like this bump right here. So he just smoothed it out, healed up beautifully. Trevor Nichols is very good. See, like, look at this. And you know the reason he's really good at it? Because he does a lot of them. I know that when Frost and Nichols, when they were together, they would do theirs during lunch hour. They had an hour and a half lunch, and they would each do one right at the start of lunchtime with an assistant, and it would take them about 15 minutes. And then they still have an hour and 15 minutes for lunch. They just, well, they recontour like every case. Another one here, I mean, you know, it's just huge improvement. These are, I mean, I can't say they're easy, but I think I could do them. I could do it. Big guy with little teeth, you know, gummy, take care of it. Here's one halfway through. See, there's a little bit of char, but that's not bad. Oh, that talks about the charring, which I've already covered. This is Wasim Basid. I don't know if some of you know Wasim from Algeria. Tom Pitts says he might be the best orthodontist in the world, but he does let these gummy smile cases. And just take, 24, 30 months. And then when he gets done, he's got this, and he doesn't want that. So he recontours every case. They're long, beautiful teeth. Now here's a case here where, I mean, that's pretty good, but he just wanted it nicer. Just a little difference there. Here's a case he sent me, and I looked at this and I thought, man, those teeth, they don't look lined up. But they were lined up. It's just the tissue. And then this kind of thing that you all see. I would use a 450 for this. See, it's big and bulky. Here's a gummy smile course that Frost has, I think twice a year in Arizona, day and a half course. Show you how to do all this. I go to these, and you see, I wasn't aware that gummy smile, has a cant. I didn't even think about that. But sometimes they're canted. I guess everything's not just like a recipe for you folks, huh? That's his gummy smile course. How do I incorporate it in the practice? It is kind of a challenge because it does take some time. You've got to figure that out. But I mean, I talk to a lot of doctors and they'll say, I can't afford not to do this. I mean, Sarver said many years ago in 2004, when he started doing this, before he started doing it, he referred them to periodontists. They never got it done. It cost $3,000, $4,000, $5,000. And his reasoning is people have 2, 3, 4 kids. They're all going through ortho. Then they're all going to go to college. They'll figure that's good enough. It's going to get better on its own, but it doesn't. So you got to figure out how you're going to do it. You can bill the dental insurance. Now, I am going to have a video sometime soon, which I'm going to send to you. I have an insurance person, 2 of them, one in Texas and one in Tennessee, that they're going to do a little Zoom for me, and I'm going to pass it on to everybody. They're the experts. But basically how they do it is they're going to use exposure 7280. They want before and after pictures. You need to get a probing chart online, like the hygienists use, and just probe just the tooth or teeth that you're going to treat. Then you have to write up 4 or 5 narratives, reuse them. And I have some examples on my website, why you're doing it. Just write it up, change the tooth number. And you're going to bill an exposure for like $400. You're going to get paid about $300. Now, these are on, the big companies, Blue Cross Blue Shield, Cigna, et cetera. They will pay you. Then up here for gingival recontouring, quadrant, 4210. You're going to bill about $600 per quadrant. They're going to pay you about $300 per quadrant. You cannot put in the narrative that it's for cosmetic reasons, some other reason, but they will pay you. I have many doctors, probably 300 or 400, that do bill the dental insurance. I have some that just charge anyway. Now, how they do that is like, let's say this right here. They're going to have this on the screen. Say, little Jimmy's adult tooth is trapped under the gums. We see this quite often. It will eventually expose itself, but it could take 8, 10, even 12 months. It's not much we can do until we can get to that tooth. Our options are, we can refer you to the periodontist. It's going to cost probably at least $2,000. Or in our office, we have a special laser, and we can use a little numbing gel, and we'll expose this tooth in about 30 seconds, and you won't feel anything during or after, and we can get on with the case. Our fee for this is $300, about $300. See Nancy up front. Now that's the gray area if you want to bill insurance or not. You could say it may be covered by your dental insurance or just charge for it. Now the patient's going to say, I thought this was going to be included. Well, this laser equipment is expensive, so we do have to charge something. But we are saving you over $1,000 and close to a year of treatment time. So if you want to charge, that's one way to do it. Or not. So let's see here. But like I say, I have many. Here's a Richard Boyd in South Carolina. This is 2007. That was 4210 as a quadrant, 325 a quadrant. This is not discount. He probably has the highest fees in the state. So only not discount houses are billing insurance. So let's get to this thick tissue. This is Damian Fisher in Georgia. He sees a lot of this really thick fibrous tissue. This little girl's teeth, the braces are going to come off. You're not even going to see her teeth. What he does is he shows the patients, the parents, images of their child, and also this case, and say about 6 months before the braces come off, and say that we're going to have to get a laser out and recontour this tissue. It's very overgrown and it won't correct itself. He charges $2,000. It's just how somebody does it. But with a diode laser, with a 980, this could take an hour. Like this here, it could take close to an hour. But with the 450, we're going to go in here first and just debulk this whole thing. Not really worry about the margin, just debulk it, and then press the button and go to 980, carbonize the tip, and do our margins. And this is, I've been told it's taking, about 15 minutes, maybe 20, where that's about the time that like a regular recontouring case, it's not all inflamed, would take with a 980. Now, something new we discovered, we have the 650 pain reduction laser. You could use the 450 and the 650 simultaneously. It can't hurt. It can't hurt. It's supposed to reduce pain. Now, the 450, the 650 pain management is really for pain associated with orthodontic adjustments. But I think it's worth a try to do the 450 and 650 for thicker procedures like this. I mean, no damage can be done. So this is another case here where Frost said this could take him 45 and now it takes him 12. Now, I do know some doctors for cases like this, they bought electrosurge units and you clean this all up with electrosurge. Now, of course, you know that electrosurge is really hot and painful and dangerous because the bone is right below here. Now, here's the 650 laser. And in the front of the laser, you press the 650 button and the timer will come up. You set it at 20 seconds. And we're going to do 20 seconds per quadrant. You, of course, put it in, press foot pedal down, and there's no heat at all. So, and you're going to put a little sleeve on this and 20 seconds for quadrant. This is Brandon Chadwell is the patient. He's an orthodontist in South Carolina, and this was at a Dr. Frost case. Frost put a expander on for him. Brandon's, I don't know what he is, maybe 50. So that expander, that was a lot of pain. So we did the pain reduction on it, and it's like amazing. He just loved it. So we actually had a prototype that I sent to him that he used for a few months. Of course, the expander didn't work that well on him because then he's going to have some surgery. But the point is it was a pain reduction. Now, and I talk about this in the video, you know, with the laser, you've got two hand pieces, but on the back, there's only one port. So if you were to use the 450 pain management a lot, you would have that plugged in all the time. And then when you want to cut, you have to unscrew this and put the other one in. So, or vice versa, whatever one you're going to use a lot, you leave on there. And the one you're not using, just kind of put it in this little thing. You can put a cap on it if you want, if you don't have time to find the cap and everything. Just every once in a while, there's a lens here that you're going to want to clean off with some alcohol. And of course, you know, this fiber wraps around the top. It's 10 feet long. You'll hear little clicks that'll hold it from going all over the place. So let's see back where was I? This was a friend of mine, Errol Yim, who's out on the Big Island. He had a palatal exposure. This is a few years ago, before I knew laser. He referred it. Patient never gets it done, but keeps coming back in the office. So they said, okay, let's pull out the laser and do it. So of course you need an injection, and it's pretty big and pretty fibrous. So he went along and they exposed this with his 980, and it took probably 7-8 minutes, but they could get on with the case. Now I do this with a 450 and do it in maybe a minute. Now also a frenectomy, I should play this. Well, actually, it's on my website, but I'll play a little bit of it. So you stretch that frenum, and that's not the setting we're going to use. We're going to do this with a 450. We're going to use either the 2.5 or 4.0. I recommend an injection for frenectomies or anything that's really big and thick. We stretch that frenum. With a 450, this is going to take, 60 seconds, maybe 90 seconds. But the wound is going to be, I have another video. Actually, I'm going to switch the other video. Now, they are going to be a little bit sore afterwards. Nothing terrible. You have to prescribe any pain medication or anything. Here's a frenectomy. This is frosted this.
This is gonna go back and forth at the base to take off
that attachment. So as you pull, you can go back and forth. It's really simple. See how simple that is? I just keep pulling on the lip to expose where that thing attaches on the sides. And just release it. This doesn't need to be a huge release. I do like to take it a little bit further, so it's not pulling itself, it's pulling so. And you're gonna release it back a little bit. So, now, we're not gonna leave her with this. If she smiles, that might show. So what we do is we just get these cotton wires. Let's just grab that. Okay, so make sure you're not feeling this, you're okay. Okay. So I'm just gonna come back and forth. These are really hard to get onto, so.
Well, you got the idea there. He's going to excise that. But now with a 450, this is much faster. Now, when he started at the base here, then we're going to go back and smooth off that little bump that's there. Now, here's another frenectomy. Actually, the reason we did this was because of that bump in between the centrals. And this was after veneers. And wanted to get rid of this bump. This was a topical only. And I know for a fact that this patient had zero post-operative discomfort because it's actually my wife and she wouldn't have held back. He's going to go smooth off this bump. But now I'd use the 450 for this because it's just faster. I'd use the 450 for everything except for precision, which is margins. You get the idea there. Now, I don't have anything to show, but I do for lingual frenectomies. If you are a pediatric dentist, of course, you do those all the time, and you'd use the 450. But my orthodontists generally don't want to do those. And I was in an office where the doctor decided to do a lingual frenectomy. Okay, looked easy. We'll just release it, release the tongue. Problem is that we severed the frenum and it didn't release the tongue. So he had to go deeper and deeper and deeper. And so the doctor knew that this patient is going to be uncomfortable later, maybe very uncomfortable. And he just didn't want to go there. So decided he's not doing those anymore. Because some of them are really simple. Some you have to go deep like that. Now, this is something kind of new we discovered. Depigmentation. You'll see some patients that have this. They don't want this. So like this. Trevor Nichols. Okay, patient comes in. Can you help me with this? Yes. Now, we use the diode laser. You set it at maybe 1.0, 1.2, and just go along and just shave off that pigment. I asked, well, how deep did you go? I went as deep as the pigment. And he also did it down here. He said in about 3 days it healed up like this without the pigment. Well, really nice. I don't know how you charge for that, but I wouldn't do it for free. Here's a case here where the pigment is gone, but it happened accidentally. The doctor recontoured the tissue like he normally does. And then when he's finished, he noticed that the pigment is missing. Now, from then on, he said, well, I'm just going to go a little bit higher and just kind of shape that and then just smooth this off too, just to get rid of that pigment. So, 1.0, 1.2, topical only, not a big deal. I did go to a dentist's office many years ago, and the patient had this same thing. The patient went to a periodontist. Periodontist wanted $10,000 to do this. So what we did is we did a little in the back, just a little bit, and then had the patient come back in a couple of weeks, and we saw it healed without any pigment and no scar. So did the whole thing. I don't know what the dentist charged. This is a dentist, not an orthodontist. So I think is about it. I mean, you might have questions if you want to have a live Zoom. I can certainly do that. I hope I've covered enough. I could go much longer, but that's about enough. So, thank you very much. Contact me anytime if you need anything. I want you to enjoy this laser. Thank you.